Hello. As you know, our topic today is HIV and AIDS, and HIV infection and AIDS prevention, and how people can protect themselves from infection. First of all, we want to define what HIV is and what AIDS are. HIV is the human immunodeficiency virus. It's the virus which causes AIDS. Simply defined, the first letter is H. It stands for human. This is a human virus. It is species specific to human beings. No other animal or organism can be infected with HIV. No other animal or organism can transmit HIV to other animals or organisms. It needs the human body condition in order to live and reproduce and thrive within the human body. Okay? The second word is immunodeficiency. It means that this virus attacks the body's immune system, the thing that protects us from disease and infection. The last word is the most important, virus. A virus is a piece of a cell. It's not a complete cell. It needs a host cell in order to live and reproduce. The host cell for HIV is human cells, primarily human white blood cells. What this virus does is enter a cell and attach itself to the DNA of that cell. When the cell splits in order to reproduce, it replicates HIV and begins a process of increasing the amount of HIV in the system. Over a period of time, HIV will reduce the T cell count within the body. T cells are a type of white blood cell which physicians measure in order to gauge the strength of the immune system. When a person has a strong immune system, they have a T cell count of about 1,000. Over a period of time, HIV reduces that T cell count to 200 or below. And at that point, 200 or below, a physician can diagnose someone as having AIDS. AIDS is the acquired immunodeficiency syndrome. It's a result of a person being infected with HIV. The first word of this term is acquired. It means that it has to come from somewhere. A person does not spontaneously develop HIV infection and does not spontaneously develop AIDS. A person must have been infected with HIV for some period of time. The second word is immunodeficiency. Again, in this term, it means that the body's immune system has been destroyed. It is no longer protecting the body. It is not functional. The body is defenseless against infection. The third word is syndrome, and again, it is the most important. AIDS is a collection of 26 different opportunistic infections which physicians use in order to diagnose the condition. Some examples would be pneumocystis carinii pneumonia, or PCP for short. It's caused by a parasitic bacteria that most people already have in their lungs. And when people have a healthy immune system, they constantly keep it in check, constantly fight it off, and never know that they have that particular bacteria. But when people do not have a strong immune system, they cannot keep it in check. They can develop pneumonia and they can die from it. Another example is a type of cancer, skin cancer, called Kaposi sarcoma, or KS for short. On the skin, it looks like a purple or brownish blotch about the size of a quarter. In people who do not have HIV infection, the only people who ever develop Kaposi sarcoma are men over age 55 of Jewish or Italian ancestry. However, in people with HIV infection, men, women, young, old, white, black, Hispanic, Oriental, all persons can develop Kaposi sarcoma, and it also can appear on internal organs and people can die from it. Some other examples that are particular to women are invasive cervical cancer and recurrent yeast infections. There are also brain infections, fungal infections, neural infections, epilepsy, dementia, drug-resistant tuberculosis. Those are just some examples of 26 different opportunistic infections which physicians use to diagnose the condition. A very important distinction is that no one has ever died from AIDS. What people have died from when you hear that someone has passed away from complications from AIDS are any one or combination of those 26 opportunistic infections. All the word AIDS means is that a person has a virus in their body and it has destroyed their immune system. This is a very important distinction because this virus affects every individual uniquely. There can be one individual with one opportunistic infection who can be dead in a week, and another individual with 5 opportunistic infections who is alive and living and working and being productive for 10 years. So it affects every individual uniquely. Okay. What happens when a person becomes infected with HIV? First of all, most people do not know that they have HIV infection when they first develop infection. Usually, there are no initial symptoms. In about 70% of the population, there are no initial symptoms. In about 30% of the population, persons may develop cold or flu-like symptoms, such as a low fever, body aches, sniffles, a cough, which will go away in 6 to 9 days. And a lot of those individuals believe that they had a cold or the flu. However, they may have contracted HIV infection. It's important to note these are what the symptoms may be like. So if a person doesn't or gets a cold, that doesn't mean that they have HIV infection. Whenever the human body is invaded by a virus, at some point, the body will start to develop antibodies to that virus. Antibodies are part of the immune system, which may most easily be understood as a sort of messenger. They go throughout the immune system and throughout the body and alert the body that something is inside, and alert the body what it is and to go attack it and fight it off. The antibodies for HIV don't develop usually for 6 to 12 weeks. It's a month and a half to 3 months. And in some rare individuals, it may take as long as 6 months. However, after 6 months, anyone who is infected will have developed antibodies. This is known as the window period, and it's a very important concept because the test for HIV infection does not test for the presence of the virus. It tests for the presence of antibodies to the virus. So if a person became infected with HIV 2 weeks ago and was tested today, the test would come back negative. It would be a false negative. A person would truly be infected and could infect others. However, the test would not pick up that infection. The period between when a person becomes infected and when they start to show symptoms of illness is called the incubation period. This is different for every human being because we all have unique immune systems. For some individuals, it might be 2 years, another 5 years, another 10 years. There are some individuals living today who have been infected with HIV for 15 years, who have never been ill. And we do not know for every single human being that they ever will become ill. We cannot make that prognosis. That's the incubation period. A few things about the word incubation. It does not mean that the virus is dormant or asleep or not doing anything. It is. It is slowly, over a period of time, destroying the immune system, but at different rates for different people. Another thing about the incubation period. When this epidemic first started, the average incubation period was 5.5 years. It has now risen to 9.3 years. And the reason is that as people become tested earlier and learn their status, there are many things that people can do in order to keep their immune system strong, such as developing a good diet, getting plenty of rest, plenty of exercise, developing a good mental attitude, reducing stress, stopping smoking cigarettes, stopping drinking alcohol, and introducing early medical therapies. All of these things can keep the immune system strong for longer periods of time. And these are things that anyone can do in order to keep themselves healthy. After this, the person develops systematic HIV infection. This is not AIDS. It means that their immune system has been weakened but not totally destroyed. A person may have a cold that might last for 3 weeks instead of 1, but they still eventually fight it off. Or they may show some very early symptoms of one of those opportunistic infections. After this, a person develops AIDS. Their immune system has been totally compromised. They are open to infection. That's a chronology of HIV infection. That's what can happen when a person becomes infected with HIV. And again, we don't know for sure for every single person that a person will ultimately develop AIDS and get sick and die. We can't say that for every person, and there are many things that a person can do to keep themselves healthy and strong and be productive. HIV is transmitted in very, very specific ways. It is only transmitted by bodily fluids, but only by very specific bodily fluids. The only fluids which transmit HIV are blood, semen, vaginal fluids or vaginal secretions, and breast milk. These are the only fluids which can possibly transmit HIV because these are the only fluids which have a high enough viral load in order to transmit infection. For example, saliva, perspiration, tears, urine, feces, or any other bodily fluid does not have a high enough viral load in order to transmit HIV. To use a comparison to help everyone understand exactly what viral load is, if we had the head of a pin, a very small head of a pin, and covered the head of that pin with blood, it would be full of HIV. Very, very high viral load. If we took 2.5 gallons of saliva, the particle count in saliva would be extremely low and in most cases non-existent. That's the amount that the Centers for Disease Control has estimated that a person would have to inject directly into their bloodstream in order for saliva to transmit HIV infection. And as we all know, injecting 2.5 gallons of anything into the body would cause someone to die very quickly. So this is how we know that only blood, semen, vaginal fluid, and breast milk can transmit HIV. Anyone can ask themselves the question about any activity or behavior in their lives or any activity or behavior which they come in contact with. Are those bodily fluids present? If those bodily fluids are present, then it's a risky behavior, and someone can avoid those behaviors or those activities and protect themselves. If those bodily fluids are not present, then it's not a risky behavior, and a person does not have any concern for becoming infected with HIV. We all have that choice. We can all make that choice to protect ourselves from HIV infection by avoiding those fluids and avoiding those particular behaviors. Risky behaviors for HIV infection include any behavior, any activity where those bodily fluids can go from one person into another person. Okay? Let's use some examples of what those behaviors might be, and some of them might surprise you. The two most commonly ways that people become infected with HIV are either sexual activity or sharing needles and syringes. But there are other ways that people become infected with HIV. Another common way for people to become infected is during pregnancy, birth, or breastfeeding. A child may become infected from their mother. We know that when that birth is through the vaginal canal or natural childbirth, the rate of infection for the child is about 1/3 of the time. We don't know why it's not more. We don't know why it's not less. That's statistically what the rate turns out to be. If that birth is through a C-section or a surgical childbirth, the rate of infection for the child is cut to about 15 to 20%. We don't know why there's a difference. They're just